They're staying with Kerala. The state has confirmed 71 brain-eating amoeba cases, 19 deaths so far this year. A new case of amoebic meningoencephalitis, a rare but often fatal brain infection, has been reported in the state of Kerala, with a 17-year-old boy in Thiruvananthapuram confirmed to have contracted the infection. Kerala health authorities are on high alert after at least 19 people died this year from primary amoebic meningoencephalitis, known as PAM, a rare and often fatal infection caused by the so-called brain-eating amoeba. State Health Minister Veena George said there is no evidence of clusters linked to a single water source. All right, so now let's just take you through what the Kerala government's advisory on this is. They're first saying avoid swimming or bathing in stagnant or unclean water bodies. That's the first note of caution that they have issued. Ensure swimming pools are adequately chlorinated is the second part of the advisory. Use clean, treated water for nasal rinsing, cleansing, and also keep home water storage tanks clean and disinfected. This is an issue which is extremely critical. A lot of people have questions on this, especially because it has again emerged from the state of Kerala. So we have with us Dr. Rahul Chawla. He's a neurologist at IVS Hospital, Delhi. Dr. Chawla, thanks for joining us live this afternoon. I have quite a few questions for you, a lot of them from our viewers. So let's just get started by asking you, can you explain in simple terms what this brain-eating amoeba is?
So brain-eating amoeba is an CNS infection which is caused by a particular variant of amoeba, that is Naegleria fowleri. It's found very rarely, and I think not more than 1,000 cases are reported worldwide. The case fatality rate of this infection is very high. It's like 90 to 95%. That means if out of 100, only 5 to 10% of people can survive this infection if treated timely with adequate ICU protocol. The problem with this infection is that it is usually found in stagnant sources of water and mainly in the tropical and subtropical environment. That is why it's flourishing in Kerala. And it is not transmitted via drinking. It's not transmitted through fecal-oral route. It is transmitted whenever we do swimming, whenever we get inside the water body and the water gets inside our nose, and from the nose it enters the brain. And
this is not passed person to person then?
No, there is no human transmission. It cannot transfer from one person to the other person. That's a very good thing. Otherwise, it could have been very fatal and it could lead to an epidemic, which is not the case.
So why is it being reported in Kerala now, doctor? Are there specific environmental factors at play that lead to this disease?
Yeah, so this amoeba usually grows in stagnant water in tropical and subtropical environments. So there has to be a warm environment with humidity. So that is why it's flourishing in Kerala. Also, in swimming pools, it can be found if the swimming pool is not properly, chlorinated or it's not properly decontaminated. Otherwise, it's not transmitted through just like drinking water. Only if you are swimming or you are into the water body, that enters your nose and then causes serious CNS infection that can be really fatal.
Dr. Chawla, who is most at risk of contracting this infection?
Actually, anyone who is immunocompromised will have more chances of getting this infection, and also anyone who is getting inside the water body, either for swimming or for any work-related job, the person is getting into that stagnant water body, even for cleaning purposes, they can get infected. So usually men, there are more cases of this infection being reported in men than the women, mainly the men of the working age group or children who are going into swimming into freshwater bodies. So more cases of these populations are being reported.
That's interesting. And can you tell us what are the early symptoms that people should watch out for?
So usually it presents like
All right, there seems to be a problem there with Dr. Chawla's line, but we'll try and reconnect with him there. Some important facts by Dr. Chawla there on what this PAM disease is all about. Remember, it's something that goes through the nose into your body and leads to the infection. Two important points being made by him out there. The first, that this cannot be transferred from person to person. It's not contagious from body to body. It goes through the nose and that's how it hits the brain. And secondly, he goes on to say that men are more at risk than women when it comes to this. Also, what's important to note here, it's in stagnant water that this disease passes through.